the most common problem people come to you with?
Desk problems are the most common thing. Improper posture and long hours of sitting. Because of a stress, mattress is not good.
Does the sleeping posture has really something to do with the overall sleep experience? Is that a myth?
Lying on your tummy causes back pain is a myth.
What are the major causes? Do you think there is anything else that causes? So, doctor, do you think you can?
4 liters of water is which we recommend. Not doing workouts definitely cause back pain. So customized mattress is always the best thing. You try, means a lot of people in India try कि 2 या 3 हफ्ते देखते हैं.
Hello everyone, I am Shruti Agrawal from Team Darzee. Today here we are at Spine Shore Clinic. We are sitting with Dr. Shrikanth Ega. He's a renowned doctor, he's a spine surgeon with over 14 years of experience in his career and more than 2,500 plus surgeries that he's done. He's here to talk to us today about how a health is completely impacted with the kind of sleep we have and how it impacts the spinal health issues that an individual has. Let's know a little more about Dr. Ega from him. So could you please tell us briefly about what your career has been like?
Sure, Shruti. Thank you for having me here. I'm Dr. Shrikanth Ega. I'm a spine surgeon. I own Spine Shore Clinic and I have been practicing since past 14 years. I have trained almost 50 physiotherapists around India, and I have a whole setup of physiotherapy here. We believe in treating a patient in a entirely conservative as well as surgical way. So I personally believe that we have to give a patient chance about treating him a conservative. It may be any kind of issue it is having. बिना surgery के ठीक करो उसको.
So that's what you mean when you say conservative?
Yes.
Without any surgery?
Yes. So I personally believe in that because for us it's another surgery. The patient, it is a cut on his body.
Correct.
So I perfectly believe that definitely we must give a chance to it, and we wholeheartedly do that thing in Spine Shore Clinic.
Okay.
Yeah.
So are you also associated with physiotherapists or you give them any sort of trainings?
Yeah, I used to give physiotherapy trainings before, but now I usually don't get time for that. I have a few therapists who work under me. I have a lead physiotherapist, Dr. Vekta, who is a master's in physiotherapy. Specifically talking, she is master's in musculoskeletal health. So she and me work as a team to treat all the patients in and around Kundapur. Yeah.
So I've also heard you have patients coming from all over India and you are called as a visiting doctor to many multi-speciality hospitals in and outside Hyderabad. So
Yeah.
can you talk about
That is true partly. There are a few incidences where I have been called for surgeries. Few seniors have called me in where I was a face, and there have been incidences where I have been a backdoor surgeon. And I have been visited places like Solapur, Pune. I have visited places like Mumbai sometimes, and in Telangana itself, I visit 4 to 5 different cities as a surgeon. Yeah.
Okay. That's amazing. You have a phenomenal experience, I should say.
Yeah.
So we would like to understand what is the most common problem that people come to you with relating to their spine problems or relating to their overall health issue.
Yeah. So pertaining to spine, if you talk, disc problems are the most common things which we see in your routine practice, but that is as a surgeon. But if you talk as a spine doctor, as a physician, day in, day out, I see at least 15 to 20 patients who come to my clinic. Most of them are with the back pain issues.
Okay.
And all of them don't have disc problems.
Okay.
So few of them definitely have mechanical back pain issues. So by mechanical, what do mean is there is a insufficiency of the back muscles. The back muscles are not supporting your spine or your overall upper back or lower back, or even you say neck, and that is why they are having these kind of issues like neck pain, upper back pain, or lower back pain.
So what are the major causes that ignite this kind of pain in an individual? Is it like purely chronic or is it something to do with the lifestyle?
Not purely chronic. If they are taken care of in a very early phase, these don't tend to become chronic. So usually what I suggest is 3 weeks of time is a good enough time for you to get relief without any medicines. You try, means a lot of people in India try कि 2 या 3 हफ्ते देखते हैं, and after that we'll see how it's going on. So 3 weeks is a good enough time if you are having any neck pain or back pain to see. Even after that, if you are having pain, we usually suggest to visit us. So coming to other question where what are the issues which cause this kind of
Right.
back problems, mechanical back pain? Most common reason is improper posture and long hours of sitting.
Okay.
So improper posture and I mean sitting is very important. See, if you see here, I have a pillow supporting my back.
Right.
Even I sit for 3 to 4 hours per day, so I definitely support my back with a thick pillow. Or you can buy a ergonomic chair for that. Second thing is sitting for long hours. So people nowadays sit for 8 to 12 hours together in on their desks
Right.
to do all the desk job.
Desk work.
So they get neck issues, upper back and lower back issues because they don't support it adequately. So this is one of the major important factor. Second thing is working along with so many hours, they don't get adequate sleep. So not getting adequate sleep is because of two reasons: because of a stress, or because your mattress is not good or your bed is not good. So stress is one of the main reasons people feel insomnia. They don't sleep adequately. By adequate sleep, I mean 7 to 8 hours of sleep is adequate sleep, which we recommend to negate all the problems related to your back also, as well as other health issues also. So coming to mattress, different people have a different back, different body habitus, different body types. So different people have a, I mean, it can you can use a word called customized. So every person is a customized in their own way. So some people find better sleeping on the floor. Some people find better sleeping on a soft surface. Some are good on a
Harder
firm
surface.
surface. So most of them, 80% if you say, are good on a firm surface. And apart from this consumption of water, I mean 4 liters of water is which we recommend usually. 3 to 4 liters is what we recommend. And if they are burning more calories, of it is a very tedious job, then 4 to 5 liters of water which is what we recommend.
Ideal.
Yeah. So if we consume inadequate water, there is a dehydration which again leads to improper muscle health and the back pains.
So, apart from these four problems, do you think there is anything else that causes an aggravated backache for people with a very sedentary lifestyle?
Yeah, for the people who are having very sedentary lifestyle, who sit for long hours and work, as I say, you need to service your body.
Right.
So I recommend at least 30 minutes to 45 minutes of workout for each and every person who are sitting for 8 hours to 12 hours of job. Any kind of workout is good. It may be yoga, swimming, jogging, light jogging, cycling, anything is good, but do some kind of workout.
Any format of
Any
moving your
format of
body.
workout. Yeah. And people who are having back pain, for them, back pain and neck pain, in that case, for them, there are different kind of exercises. For few people, yoga is a very good thing to go. And in our setup, we do teach a lot of exercises which are based on levels. So here, when the patient comes to me, if a patient is coming to me with a back pain, I usually start them on a level 1 exercise.
Okay.
So we teach them, we ask them to do it perfectly, and once they're doing it perfectly, then we go to level 2, level 3, and then level 4. This is the way we have made a program in Spine Shoe Clinic, and that is the way we go. So definitely workout plays a significant role in having a back pain. I mean, not doing workouts definitely cause back pain. Yeah.
Okay. Do you think there is a specific relationship between sleep and the spine health of an individual?
Yeah, sleep is very important because sleep relaxes your muscle over the period of time. In the night time when you're sleeping, your muscles are relaxed and they get hydrated, they get adequate time to rest.
Right.
Along with that, the ligaments also relax, and there is adequate hydration of discs which happens. So if you are having inadequate sleep, all these factors are negated. I mean, your muscles are not rested enough, they don't relax enough, and your discs don't get hydrated enough. So all these things can cause muscle stiffness, and then muscle spasm, muscle sprain, and then acute to chronic back pain.
Got it.
Yeah.
So, the cervical problem, the usual neck ache that an individual faces, do you think that is typically because of the sleep patterns they have or the sleep surfaces they are sleeping on, or do they also have something to do with their lifestyle?
Yeah, lifestyle is definitely a issue. Again, sitting on in front of a screen. I mean, how do you look at a screen? You're looking down below, always looking at your mobile or your screen. Laptop is on your lap, and you're looking at your screen
The
with the
angle
neck.
of the neck.
The angle of the neck does have a role. If your long hours, if your angle is, I mean, your neck is, your eyes are seeing below,
Aching.
and your neck is bent, definitely you tend to get more neck pain.
Okay.
So I recommend to see them straight or little bit at a higher pitch of 10 degrees, and at that level they are good to work. Coming to the sleep and coming to the surface where they sleep, every individual have a different recommendation. Some people are good with a thinner pillow. Some people feel better on a thicker pillow. And memory foams are usually the people, 80% of people, my patients at least, are comfortable on memory foam pillows. And for people who are already having neck issues, basically the people, they get this, the pain is in this region.
Right.
This is not exactly the neck, this is upper back also. So there is a muscle called trapezius. Okay. So this muscle goes stiff when you are working for such a long time. So for those kind of patients, we recommend to fill this gap. If they are sleeping mostly on their sides, we recommend to fill this gap with the thickness of that pillow so that the strain on the muscle is less.
So basically, whether you're a back sleeper or a side sleeper, oh, that brings me to the point. Does the sleeping posture has really something to do with the overall sleep experience? Is that a myth?
Yeah, no. See, for the normal people who are sleeping, it's God given. You want to sleep any way you can sleep. I mean, lying on a prone position, lying on your tummy causes back pain is a myth. You know, it doesn't cause you back pain.
Wow.
Because all other factors has to be taken care of. If you are not doing these things, and if you say, "Ki I am lying on my tummy and I am having back pain," no, it doesn't make sense. So lying on your tummy doesn't give you back pain. Having said that, there are few postures for the people who are suffering from the back pain. So, for the people who are having back pain, or for the patients who are having sciatica, we do recommend some postures so that they are comfortable in that positions. There are two different positions we usually suggest, like the kids sleep. I mean, kids sleep on the side with the knees bent towards the tummy.
Cool.
So that's a very relaxed position. It relaxes all your muscles. It relaxes your sciatic nerve. So it's a very good position for people who are suffering from back pain and sciatica. Second thing, if the patients tend to lie straight, I mean, there are some people who, I mean, hilte nahi hai, they are just straight, they are lying like like a cop. Okay, so for them we recommend to take a pillow below the knees. Okay. So the knees and hips are in a bent position, at least 20 to 30 degrees of bent position. So what happens is, again, that structure, that position, that posture relaxes all your back muscles, your back thigh muscles, as well as your sciatic nerve, and they start feeling better.
Don't you think it's very unusual that an individual is sleeping in the same position all through the night?
It's not possible.
Not possible.
It's not possible. Very few people sleep like सावधान. Okay.
Basically, जैसे भी सोया है वो खाली सोने वाला position है. After once I'm
you definitely keep on changing position as you age specifically.
Okay.
People tend to get shoulder pains, people tend to get back pains, they tend to get knee pains. So specifically for people who are having left shoulder pain, for example, they don't lie on left side. They have to lie on right side.
Right.
They have to change. If they are lying down continuously on right side, definitely they'll get numbness in the hand. They have to change the posture. Right. Either they have to go lie on the tummy or straight on the right side.
Because that one specific part has been strained a lot, just sleeping on that one angle,
Yes.
and automatically the body tends to change the posture.
Yes. Sleep physicians can enlighten more on this, but as per my experience, people don't sleep in a single position throughout the night. There are very few people who do that, but you tend to change the position day and night.
Left to right, back.
Yes, definitely.
Got it. So, like you said, there is no ideal sleep position.
Okay.
Do you think there is an ideal mattress or an ideal comfort level that suits an individual requirement?
No, there is nothing called as ideal mattress. It is again customized. Few people are happy lying down on the floor, and they are very comfortable throughout their life. They don't have any back issues and all. There are few people who lie on the floor and they start getting back pain.
Okay.
There are few patients who come to me. They say, I had back pain since past 10 days, sir. I tried sleeping on the floor also, but I was not feeling comfortable. So that is also there. Second thing is, there are few patients who are very fine on a soft surface. They feel comfortable only on the soft surface. They are not good, or they don't feel better on a hard surface or on a firm surface. Most of them who come to me and who are relieved of the back pain, usually they are using the firm mattress. So people, 80% of the public like lying down on the firm mattress, which is both supporting your back, which is both comfortable, as well as it supports your back. So that is the one which I usually recommend them. Most of them I recommend, and few of the patients who come to me, I recommend them the firm mattress only. The one who come to me with the back pain and neck pain issues, I recommend them firm mattress only. Yeah.
Okay, so ideally I can say that there is no ideally right surface to sleep on. everybody has their individual requirement and their comfort levels. But
Yes.
if taking your suggestion, you're suggesting something with a good support. Any
Yeah.
mattress which is giving a good support is what you are
Yes.
recommending.
Yes. Yes. Yes.
So basically, what I understand is there is no ideal sleep surface for anybody. You have a specific sleep requirement, and a mattress has to be according to the sleep requirement that you have. Whether it is hard or soft doesn't make really any difference.
No. So as I said, customized. I mean, every person is different. So some people feel good on the hard, some people are good on firm, and some are good on soft. So customized mattress is always the best thing, which I think so that it will be more helpful to the patients. So here in Darzee, which you represent, definitely you give an option of a customization. So that definitely help a lot of my patients, and they're really happy with that. So the back pain issue has been taken care over here, but they don't tend to do the exercise for long term. As I said, level 1, level 2 to level 4 exercise are there. They usually don't tend to do that for lifelong. So what I suggest is at least you go for a better mattress. So mattresses, when they use this mattress, they are better off. I mean, the back pain issues are, I mean, the amount of pain which has come down to is significantly less than 80%.
So ideally, you mean there is no right or wrong surface for anybody. There's no surface that is universally perfect for a sleeping solution, right? That's exactly what I'm trying to understand.
Yes, you got it right. Yes, yes. So as I said, some people are good on hard surface, some are good on firm surface. So every person is different, and every person needs a customized thing. So here in Darzee, which you represent, definitely you give an option of a customization. So that definitely help a lot of my patients. I have sent at least 20-25 patients to your place, and it has helped it. So whatever material you use, like latex or foam, and mixture of it, they get a chance to trial on it, and then they can choose it. So at least 80% of my patients tell that, yeah, the back pain has come to us. I mean, it has come significantly down, and it has helped them a lot. Yeah.
So this difference of overall health issue is what we're discussing about the people who are coming with a lifestyle related backache problem,
Yes.
not for the people who come with a chronic back issue.
No,
Definitely.
no. But the people who are having disc issues or some pathologies going on inside, apart from mechanical back pain, for them actually it doesn't matter whether they are sleeping on any kind of mattress. The things which we are discussing about the people who are having lifestyle problems.
Right.
Yeah. So ideally, the mattress must support them in whichever position they sleep, and as well as they give them much and more comfort as much as
A
possible.
refreshed morning
Yes,
after
yes.
a
Yeah,
night's
refreshed
sleep.
morning. Yeah.
Right. Basically, that impacts the overall day's experience of an
Exactly,
individual.
exactly. Yes,
Right.
yes.
So, doctor, do you think you can give any good 5 top tips to have a better spine health?
Yeah. So 5 tips. Okay. So first tip is, if you're doing a sitting job, I mean 8 to 12 hours of job, if you're sitting, then definitely you have to get up for at least after every 2 hours and walk for at least 5 to 10 minutes, stretch your back and neck, stretch your shoulders, and go and sit again. You can have a coffee break of 10 minutes, have a water break of 10 minutes. You can stretch in between them. So if you're working for 8 hours, take at least 4 breaks. Second thing is keeping your laptop at eye level, and not slouching forward, so that your muscles tend to get weak. Second thing which has to be done is workouts compulsorily. You do yoga, you do light jogging, walking, any kind of workout will hydrate your muscles, and it improves your calcium in your bones, it improves the hydration of your discs, and it decreases the chances of getting back pain. Not only back pain, any kind of disease like diabetes, hypertension, hyperlipidemia, I mean cholesterol burden and all these things can be taken care of with at least 30 to 45 minutes of exercise. uh, 7 to 8 hours of sleep is the third one which I'm banking upon. It is much more important for your backache, as well as for the people who are having hypertension, who are having stress related issues, anxiety issues and all. For all of them, 7 to 8 hours of sleep is recommended. So the fifth point is adequate hydration, which we recommend. 4 to 5 liters of water is what we recommend. 3 to 5 liters if you specifically talk. 3.5 liters for females, and 4 to 4.5 liters for males. Yeah, those are the 5 tips which I would recommend to get rid of back pain or prevent back pain.
Thank you so much, doctor. It was so nice talking to you and knowing so much, like bursting so many myths and knowing so much about individual spine health. And I'm super glad that I have been able to help so many of your clients, and definitely looking forward to so many more collaborations and associations to be able to help your patients have a better night experience.
Sure. Sure.
Thank you so much for
Thank
having
you.
this.